Hello, this is Cherries. Today's topic is about the stages of diabetic retinopathy. The details I'm sharing is based on clinical practical guidelines for screening of diabetic retinopathy published in June 2011. I'll be using shorts occasionally such as DR for diabetic retinopathy. First screening for diabetic retinopathy should be done at the time of diagnosis for adults and children with type 2 diabetes mellitus. Meanwhile, women with diabetes prior to pregnancy should also be screened. There are a total of 6 stages of DR, which ranges from diabetic without retinopathy, non-proliferative diabetic retinopathy, proliferative diabetic retinopathy, and advanced diabetic eye disease. Each of the stages differs with its own funduscopic findings. This is a normal fundus picture of the right eye, which can be seen in a diabetic patient without retinopathy. The optic disc appears pink with well-defined margin and a cup-to-disc ratio of 0.3. The vasculature is normal in course and caliber. We can appreciate that the macula is clear. Microaneurysms are the earliest clinically visible changes of diabetic retinopathy. In mild non-proliferative DR, there can be up to 5 microaneurysms. Moderate non-proliferative DR has more microaneurysms but is less severe than severe non-proliferative DR. This is an illustration showing the defining features of severe non-proliferative DR based on the 4-2-1 criteria. Firstly, the number 4 for more than 20 dot and blot hemorrhages or microaneurysms present in each of 4 quadrants of retina. Next, we can appreciate the veins of retina appearing like a string of sausages. For severe NPDR, there can be venous beading in 2 or more quadrants. Intraretinal microvascular abnormalities, also known as IRMA, arises within the ischemic retina. In severe NPDR, IRMA can be present in 1 or more quadrants. Can you guess the diagnosis of this fundus photo? The answer is proliferative diabetic retinopathy. The keyword here is proliferative, so we can see that there are proliferation of the new vessels formed at the optic disc, known as neovascularization of the disc, and new vessels in other regions, known as neovascularization elsewhere. In some cases, the presence of preretinal hemorrhage also points to PDR. Well, this is not a true fundus photo. The strokes of grey are added by editing. Typically, this can be seen in the case of advanced diabetic eye disease, where we can appreciate the fibrovascular tissue proliferation. Other than that, ADED can also have traction retinal detachment, retinal distortion, and rhegmatogenous retinal detachment. To sum up, mild NPDR has only microaneurysms. 4-to-1 criteria is used for diagnosing severe NPDR, whereas moderate NPDR is between mild and severe NPDR. Neovascularization signifies PDR, and fibrovascular tissue and retinal detachment points towards ADED. That is all for today. Is this video helpful? Like and subscribe. Bye!